Welcome to Pro Health Physical Therapy and Pilates Studio, located in Peachtree City, Georgia. I'm Dr. Karyn Staples, here to bring you a posture checklist to lay the foundation for better and more efficient movement. We're starting at the feet. So with your foot on the ground, lift it up and notice that you have 3 centers that your weight will be. The ball of the foot by the big toe, a spot between the 4th and the 5th toes, and a center part at the heel. Noticing that these lines make a triangle on the bottom of your foot. So coming up to standing, we line those feet up so they're about your fist width apart, which makes sure that our feet are in line with our hips. Lift up your toes, so just the digits, so the balls of your feet are anchored on the ground. And notice that you can shift that weight towards the big toe and towards the little toe and find that weight balanced. Notice how you can shift your weight forward and back. If you shift too far back towards your heels, notice how your weight will try to shift and you might lose your balance backwards. If you shift your weight too far forward, notice how it's hard to keep your toes up. Finding that place in the center where it's easy to lift those toes, keeping that weight centered on the balls of the feet and your heels. Allow your toes to lower. And notice if you scan up, it automatically relaxed your knees. Gently right there, if you go up to your knees, notice how you can really push those legs super straight, but then gently relax them. And as you relax them, notice how those knees are out of their locked position. As we scroll up, following that thigh bone all the way up to the ball of the hip, we come up over towards your pelvis. And at your pelvis, notice how you can gently rock forward, which makes your back arch more, or we rock backwards, bringing your pubic bone towards your belly button, and that makes your back a little less rounded. We want to find the position where that pubic bone is parallel to the wall in front. By it being parallel, it allows that pelvis to be lined up right over top of the thigh bone, which then lines up over the shin bone and lines up with the second toe. So keeping that pelvis nice and anchored, we take our hands now to the very top of your pelvis. And then you scrunch in your hands a little bit and notice that you have a little soft part, and that's our waist. And between the top part of the pelvis and our 10th rib, we want to be able to have some space. Now we actually have 12 ribs, so the first 2 you're going to feel are the floaters. But if we pass by those, we get to number 10. And if you're not sure if you're at number 10, start at the base of your breastbone and slowly walk along that hard cartilaginous part and find the last rib. And you'll know it's there because if you go a little bit further, you'll feel a little tender spot, and that's probably the front of rib number 11. You take your fingers and let your fingers sink in to that space between that 10th rib and the top of your pelvis. The goal is at least 3 of your fingers between the top of the pelvis and that 10th rib to have that much space between your pelvis and your rib cage. Now when we come up to your rib cage, the rib cage has the potential to shift forward, shift back, or shift side to side. The goal is that rib cage lines up directly over top of your pelvis and directly under your shoulders. So the idea is our body is lined up as if they're stacked rings lined up on top of one another, just like the stacking of a slinky. That the rings are allowed to open and close and move in various directions, however they stay lined up on top of one another. Noticing that if my rib cage shifts forward, my pelvis has to shift back to make sure my balance, my center of gravity stays balanced as best as possible. But it puts more strain on other structures of your body. So if we maintain that pubic bone parallel to the front, we keep that space between your pelvis and the rib cage, and then we keep that breastbone nice and proud to the front. So our breastbone and pubic bone are in a nice vertical line towards one another. Then we take our arms. Those arms, gently turn those hands, palms forward. Once they're palms forward, notice how it keeps your chest nice and proud and open. From your elbows down, relax those arms. Noticing that at the forearms, we do have the capability to turn them palms up and palms down. Taking those arms and we open them, we can then relax right in here. That keeps our shoulders, that shoulder ring lined up right over our rib cage, right over our pelvis. Now if we move up to our head, take your hand and bring your fingertips to the tip of your chin and bring the base of your hand to your breastbone. Now, as we line up here, we want to make sure that that lineup stays, so meaning our head is right in line with our shoulders. If you can't reach your hand toward your body, it means your head is too far in front of you. If it touches too soon, your head is too far behind. So notice how my voice changed if I was too far forward or too far back, and how my voice seems much more calm when I'm here in the center. Now take your hands and bring your thumb and your index finger about 2 inches apart. Make the top of your thumbnail rest on the notch of that breastbone, and bring the nail of your index finger to your chin. If you notice you can't reach it, it most likely means that your chin is up too high. If you notice that you're poking your throat, it means your head is too far forward. If you pull that head back and rest the tip of your chin, so this underside here, right onto that thumbnail, or that index fingernail, and your thumbnail onto that breastbone, everything stays lined up just as it should be. The last element is making sure you're thinking that there's a string pulling you up towards the ceiling. So we have our body lined up from our feet, up our legs, pelvis, rib cage, shoulders, and head. Take a nice deep breath in, feeling that energy flow from top to bottom, getting that whole rib cage to move. Let in the air out. And thank you for joining me today for this posture checklist. I'm Dr. Karyn Staples with Pro Health Physical Therapy and Pilates Studio.